Now on to the COVID-19 situation here in South Korea. Health authorities have announced fresh virus prevention measures to deal with a resurgence in the numbers of infections. The biggest changes will affect the country's vaccination program. Song Yoo-jin with the details.
More people in South Korea will now be rolling up their sleeves for a second booster. Currently, the shot is only advised for people aged 60 and above and the immunocompromised. But things are about to change as the Central Disaster and Safety Countermeasures headquarters laid out fresh virus prevention measures Wednesday morning.
We'll also roll out the second booster for people aged 50 and above, as well as those 18 and older who have underlying health conditions.
The government will also work to increase vaccination rates at high-risk facilities, such as that for the disabled and the homeless. In terms of treatment, health officials will secure more sick beds for a maximum 200,000 critically ill patients. And for those who are receiving treatment at home, they will increase the number of the so-called one-stop COVID-19 treatment centers to 10,000 by the end of this month. These centers provide COVID-19 testing, treatment, and prescriptions all at once. Currently, there are about 6,300 of them. But some rules will remain as they are for the time being.
The mandatory 7-day quarantine will stay, although stricter social distancing measures will not be imposed. But circumstances may change depending on the country's virus situation.
This comes as South Korea saw 40,266 new infections as of Tuesday midnight. That's more than double the figure reported at the same time last week and is the first time in more than 2 months that the tally has topped 40,000. There were 12 related deaths and there were 67 patients reported as being critically ill. Song Yoo-jin, Arirang News.